Hi, my name is Dr. Sandra Dorman, and I'm the Director of the Center for Research in Occupational Safety and Health. I'm here talking today about the Northern Ontario Community Immunity Series. And today, we're interested in how did we develop the COVID-19 vaccine so efficiently? To see the rest of the series, please visit our website at crosh.ca. That's crosh.ca. So let's begin. First, we acknowledge that vaccines can take a long time to develop, and there's lots of good reasons for this, including vaccine development costs a lot of money, and it can take researchers years to raise enough funds to initiate the process. Number two, once you've got a vaccine developed, you have to get people to volunteer to test the product, and that can be really difficult. It can take a long time to get enough people to volunteer to test the vaccine. After that, they have to be out in a community that has enough disease rates for them to get adequately exposed to evaluate how well the vaccine worked. And again, that can take a very long time. And lastly, once the vaccine has been effectively identified and proven to be effective, it can still take even longer to build the factories and to develop the supply route necessary to distribute the vaccine globally. So let's compare that to the COVID vaccine. First, billions of dollars were rapidly invested in the development of a COVID vaccine. Second, thousands of people stepped forward to volunteer to test out the vaccine. Third, the disease spread so rapidly in communities that vaccinated individuals were quickly exposed, which allowed for pretty rapid data collection for an analysis of the effectiveness of the vaccines. And lastly, again, collaboration occurred on a national and international level with lots of money to build factories rapidly and to support the supply chain to disseminate the vaccines globally. So that's a big reason why we were able to develop them efficiently. I know people are also concerned, though, about the fact that the vaccines approved in Canada are what are called mRNA vaccines. And the perception is that this technology is relatively new. But you should know that's not entirely true. People have been using mRNA technology in medicine for over 30 years. The formula for the development of the vaccine was actually initiated prior to the COVID-19 because SARS had infected our community and MERS. And both of those are coronaviruses as well. And so they were actually able to take the vaccines that were being developed for those viruses and tailor them for COVID-19. Luckily, COVID-19 is also considered to be a fairly simple virus in that although it does mutate, it doesn't seem to mutate as quickly as other viruses like the flu virus. And lastly, researchers have been studying the technology for using mRNA vaccines long before the pandemic arrived. And so for all of those reasons, although mRNA seems new to you, it's not as new as you think it is. The last point I'd like to make is around concerns with how quickly the safety of the vaccines were evaluated. And yes, particularly when the vaccines were first being disseminated to people, not a lot of time had elapsed after the development of the vaccines. However, past experience with vaccines has shown us that usually if there's going to be any side effects that show up, it happens within the first 2 months. And so there was enough time to assess that level. In addition, since then, there's been enough time that Health Canada has been able to confirm that the vaccines are safe. And if you consider globally, 6 billion doses have been administered over 183 countries. And in Canada, over 53 million doses have been administered. And out of all those doses, 99.99% of people have reported no adverse side effects. The government has concluded that all the vaccines approved in Canada are not only highly efficient or effective at preventing severe illness, hospitalization, and death due to COVID, but they're also safe. And for more information on the risks and benefits of vaccination, Tune into our next video, Assessing the Risks and Benefits, Making Informed Choices about Vaccination. The Northern Ontario Community Immunity Series was funded by the Natural Sciences and Engineering Research Council.